Good morning guys, I am Dr. Prince Rawat and I have started a series where I will tell you the most repeatedly asked topic from all the 19 subjects for FMGE. I have already finished the 3 subjects. So now I will start with obstetrics and gynecology. It is one of the most important subject. At least 30 to 35 question is asked from this subject only, and this is very easy subject as far as my experience. It is very easy. You cannot tend to miss this questions, okay, and you cannot mark wrong answers in this. It is very easy. You just need to focus on the key topics, as well as you have to understand the basics about it. So I will start with the most important topics. The first is antenatal checkups and changes during pregnancy. It is the starting of the obstetrics. All right, so you cannot miss this. This topic is asked associated with PSM as well. Changes during pregnancy, they will ask you, for example, what will be the cardiac changes, what will be the lung capacity changes. They will also ask you what is physiological anemia. Okay, this is the very basic stuff. Then the second very important topic is the signs. What is the Chadwick sign, what is Goodwell sign, what is Hagar sign. During my exam in January 2025, at least 4 question was asked just from the signs itself. Okay, 4 question. All this I have told you: Chadwick, Hagar, Goodwell, everything they asked. 4 questions. So you can understand how important and how easy it is. Then the topic is diabetes in pregnancy. Very important. You should know what is gestational diabetes. Then what is overt diabetes. You should know the DIPSI criteria. You should know about the 75 gram OGTT test. All right, how will you treat it? Which drug can you give? Oral drug, which oral drug is beneficial. Then how will you give insulin if it is needed or not? What can be the complication? Like the complication could be polyhydramnios. So you have to read everything step by step. All right, what will be the disease diagnosis, what will be the complication, and how you are going to manage it. Then comes the hypertension in pregnancy. Again, evergreen topic. Every time there is a question: what is gestational hypertension, what is chronic hypertension, what is preeclampsia, what is hypertension superimposed with preeclampsia, when will eclampsia will occur. Then the complication about it is HELP syndrome. What is HELP syndrome? Then how are you going to treat this? How will you going to treat the hypertension? If not, how will you treat the eclampsia? What is the role of magnesium sulfate? How you are going to give the magnesium sulfate, like the Pritchard regimen. Then while giving magnesium sulfate, if there is toxicity, which drug will you give? What are the signs of toxicity? All right, see, again, this is step by step approach. You have to read step by step, not just mug up everything. It is step by step. It is very easy, and you can remember all this as well. Then abortion is again very important topic. Threatened abortion, missed abortion, inevitable abortion, abortion during second trimester, recurrent abortion in third trimester. What could be the reason? This is again very important topic. MTP and IUCD, both are very important topic. MTP, they will ask you, if there is a contraceptive failure, when can you use MTP? If suppose if there is a rape case, what weeks you can do it? If there is congenital anomalies, at what weeks you can do it? Suppose who can do it? The doctor can do it, OB Gyne. Then what is the panel, like obstetrics, pediatric, radiologic, and everything. You have to read everything about MTP as well. Then another topic is ectopic pregnancy. Ectopic pregnancy, they will ask you what is the medical management, what is the surgical management, what are the criteria of medical, as well as what are the criteria of surgical management. For example, they can give you a history about positive urine pregnancy test, but there is nothing found on the USG. See, like this, they are going to give you a diagnosis or somewhat probable diagnosis about ectopic pregnancy, and based on that you have to make the correct approach. Then what is molar pregnancy? Is it normal or is it abnormal? Will the baby survive? Will the baby will not survive? What is complete mole? What is partial mole? What is the karyotype of complete and partial mole? This is the very basic topic. Will the mole be converted into cancerous, or it will not convert? Then postpartum hemorrhage, one of the most important topic again. What is the most common reason of postpartum hemorrhage? Like atonicity. Then they will ask you how will you manage it. Then which instrument you can use to control postpartum hemorrhage, which is the Bakri balloon, like that. You have to read about the postpartum hemorrhage. Then they can ask you about instrumental delivery, type of placenta, oligohydramnios versus polyhydramnios. Then again important topic is fistula formation. Then they will ask you in gynecology about what is genital TB. They can ask you about uterine inversion, what is uterine prolapse. Again important topic is shoulder dystocia, what is the NT-D protocol. They can ask you question on CTG tracing as well. For that also CTG they will ask you what is acceleration, what is deceleration. You must have known the mnemonic as well for the CTG. Right now I cannot remember it, but for CTG I can say you like Dr. C. Bravado. Alright. Then they will ask you about amenorrhea, okay, primary amenorrhea as well as secondary amenorrhea. Also they can ask you about abnormal uterine bleeding. For that the mnemonic is palm coin. You have to read about it, it is very important. Associated with it, what is Asherman syndrome, then what is Sheehan syndrome, like that they can also ask. Most important topic, PCOD, endometriosis. Every time at least one question from either one of them or both of them, endometriosis and PCOD. For example, in endometriosis they can tell you there is a chocolate cyst in the ovary, what is it? So you can tell you it is endometriosis inside the ovary that causes chocolate cyst. Then they can ask about PCOD. You already know there are the three triad of PCOD, but there can be also another type which is called lean PCOD, where the patient does not have the fat body, the bulky body, but the patient is lean. However, the patient still has the facial hair, also amenorrhea or like that. So you have to read about PCOD. What is a necklace sign, the necklace sign in PCOD, how you are going to manage it, like drilling. You can do drilling in the ovary, or you can do medical management as well. So you have to read everything about it. Then they will also ask you about the vaginal infection, for example bacterial vaginosis, trichomoniasis, candidiasis. Again it can be asked associated with PSM as well, but every time there is one question, where can you see Klucel, then what is the treatment, where will you give albendazole or something like that. Then they can ask you about types of uterus, what is septate uterus, didelphus uterus. IUCD, I have already told you, you should know IUCD, which is permicidal, then which will change the morphology inside the uterus, which will inhibit the fertilization, like that. You have to read everything. Also read about how long a contraceptive will work. Okay, so this is also very important topic. How long a contraceptive will work. For example, about copper T, how long you can put the copper T. If you are using implant, how long you can put implant, what are the type of implants. If you are using condom, how many types of condom are there, like male condom, female condom, like that. If you are using sponge, how many ml of the menstrual blood it can hold, like that. Is it reusable or not, like very basic question, but they still tend to ask this. Then the last and very important question is carcinoma, cervix, uterus and vulva carcinoma. It is again one of the most important topic. So this is the list of very important topics in obstetrics and gynecology. So if 35 question is asked, I am 100% sure at least 20 to 28 question will be definitely from this topic itself, because they are evergreen topic. And if they are not going to ask you question on this, then what are they going to ask you? All right, this is a screening exam. Okay, you are not going to become a Obs Gyne resident from this exam. So read about it. This is the very important topics. Do not miss this. Definitely there will be question from this. The picture of this topics is already in my Telegram group, and the link for Telegram group is in the description. Also follow my YouTube channel, because I'm going to finish all the most important topics of all 19 subjects. So I will meet you in next video. Thank you.